I'm here with you, and our Health Vibes listeners always give me life. So I like to be here on Health Vibes. Just yesterday, I called someone and person heard my voice and they said, "Is that Trudy from Health Vibes? I
Mhm.
listen to that program every Wednesday and I love that program." And I said, that is it. That is it. I love to hear that. And every time I get a new person telling me they listen every Wednesday, that really lifts my spirit. So good morning to our listeners.
Definitely. Good
We,
morning.
yes.
And my usual way of describing Trudy is looking almost British this morning. So she's wearing a nice cotton long sleeve shirt,
Yes, white.
white,
Hmm.
with a nice cashmere sweater,
Hmm.
half half cashmere sweater, so there's no sleeve to it,
Hmm.
with horizontal blue going across that white. It looks quite British, European this morning. Like the boarding school, the way the students would dress, that type of thing. Yeah, she's looking dapper, as they would say in this outfit. But we're happy to have you on. As we said, today we are in for a really, really good show. We will be joining our guests shortly, sometime just about 10:30. But before we do so, let me say to you that we are so excited to bring to you the first edition for 2025 Cardio Jam number one.
Oh, wow.
And we are doing that in partnership with the management and staff of Big W We Church, HHV We Church. And we are doing this right outside in the yard of Big W tomorrow afternoon, just about 4 o'clock.
Thursday afternoon,
Yes,
tomorrow.
tomorrow,
Okay.
Thursday afternoon.
Okay.
The just about, I think it may be 4 or 30 thereabout.
Okay.
It begins, but it's 1 hour. You would expect music to be there. You would expect people to be packed. We want you to walk with your clothing, your sneaker, your rag, and really come to have 30, well, rather 60 minutes of cardio exercises. Well, as you know, I am a runner. I run. Yesterday, I actually did almost a 4 kilometer run in 16 minutes.
Carlton and I saw you
Yes. Oh,
yesterday,
you saw
and I
me.
want to tell the listeners when Carlton is running, is the focus on his face,
That's
you know. Carlton, I couldn't even get Carlton's attention. I passed you on the bridge, um, the KFC bridge,
so I
that
was
bridge.
just kind of concluding.
Yes.
Yes.
And Carlton was looking focused. I mean, the running outfit was on point. So Carlton takes that seriously,
Very
as he
seriously.
should.
Very seriously. And when I completed my run, I said, what, 16 minutes I take to do that run? From Jolly's up to the CUM Church in Goodwill, across to the hospital, downward to the Pentecostal Church, from the Pentecostal Church at the back of SMAT, reached by Maboyd, from Maboyd back into Roseau. In 16 minutes and I think 18 seconds, I did that yesterday. And when I concluded the run, I was like, wow, that was quick. I had so much energy, I went CrossFit for another
Ah,
hour.
wow.
So I did CrossFit yesterday as well. And I had maximum energy in CrossFit. I never felt I was burnt out or anything. And so today I'm going to do my run and then go back CrossFit in the afternoon. So we want to encourage you to keep moving, motivate yourself, recognize that your health is actually your health. And there is no better way to do it but to invest in it, invest in
Hmm.
your health. So we're having this cardio jam session. It's dubbed carnival warm-up session. That's happening tomorrow afternoon. That is Thursday, tomorrow, Thursday afternoon. We're doing this complimentary Big W, and we're using the yard right outside by the road. And we expect as many people, if you're in the Maho, Masak, Kinfield area, it's close to you. We want you to just take a bus, walk across, whatever it is, and join us. There is absolutely no admission fee. All you do, you walk with your necessities and you join. the cardio job.
Nice,
Okay.
nice, nice.
Um, our sex symposium, that's really buzzing. I saw the flyer. I love the flyer. The marketing department showed it to me this morning. I said, yes, I love this flyer. So we've gotten the approval to use the auditorium of UE, and we're excited about this. This is happening February 13. That is one day before Valentine's Day, the eve of Valentine's. I know Trudy is all excited. Trudy, Trudy and I will be hosting this, and I think you're going to find us in a very vulnerable side. We will not be speaking like Health Vibes host and hostess. We will be in a different frame of mind,
Oh, yeah.
and we'll be in a different vibes, because we want everybody that's attending to be as relaxed and open as possible. So we'll
Mhm.
be discussing everything relating to sexual and reproductive health. It is not going to be a cheesy kind of a wash your foot and come kind of a thing. We have professional people who will be giving you the facts as it relates to what's happening in the world of sex. We've never had any type of forum like this in Dominica ever, from since I know myself.
Mhm.
And we are excited to bring this to you. We get all the talk about the high blood pressure, the diabetes, and all of that, which are great topics. But sometimes you have to shift the goalposts a little.
Mhm.
And so we are bringing this amazing topic to you. And guess what? Admission is free. All you have to be is an adult, 18 years and above, to attend. Walk with your boyfriend, walk with your girlfriend, walk with your wife, walk with your husband, walk with your side chick, walk with whoever you want to walk with. We are not discriminating at all in this symposium. So whether it's same gender, whatever it is, we are open to everything and everybody. So we want you to be comfortable, come and listen, come and learn, and just really come with an open energy and open spirit to learn things that are new and things that are also old as well.
Mhm. Mhm.
But they might have come with a little modification. Let's
Right.
put it like that.
Mhm.
So we are. I guess you feel in my voice and energy on this topic,
Mhm.
and we are ready and setting all the goals together to make this sex symposium an awesome one. And hopefully, we will make it maybe something an annual one, maybe
Mhm.
focusing on a different area relating to intimacy and
Mhm.
relationships.
And Carlton, I know the last time, well, you remember, well, last year we were gearing up for it
Yes.
and then we had to postpone. So it's on this year. But I remember last year, somebody spoke to me and said they're really interested in going, but they want to come and they didn't feel comfortable telling their husband about their interest in going.
Mm.
Now, I want to say this is a perfect opportunity to, as you said, Carlton, bring your significant other or your side, whatever it is, or your intended
Mhm.
significant other. And really, it can be a conversation starter
That's very
between
true.
the two
Hmm.
people. If you have some sort of anxiety about discussing certain things, or there are certain things as it relates to your sexual and reproductive health, or your partnership with an individual sexually, and you've always wanted to voice a certain topic area, you have
Hmm.
something in your mind, but you feel a little shy or a little apprehensive, I think that this event is a good conversation starter as well for couples. So don't be afraid to tell your husband, let's go to this thing, or tell your wife or tell your boyfriend or girlfriend, let's go to this thing, because you don't know how well it could help you to start certain
That's
conversations
true.
in the future. Maybe something that you really wanted to talk to the person about, and you're like, you remember we heard that at the sex symposium on February 13th. What are your views on that, Nabib? And then the conversation can really start. So I like that opportunity for couples.
Right.
Mm-hmm.
And we invite, ladies' nights or boys' nights, or you're gonna hook around with your friends and say, we're
Mm-hmm.
hearing about this thing, let's go across. We have some very interesting areas that we want to focus on in that symposium. We're looking at relationship barriers, we're looking at sex toys, we're looking at oral sex, we're looking at the whole new paradigm shift of open relationship and swinging
Mm-hmm.
and all of that. So we're really going into some deep stuff that some people may not be very comfortable about hearing or wanting to discuss, but we know it's happening and we know it is a wrong. And just like we are now, years a few years ago, 2020, by the year 2000, everybody was wondering what was going to happen with the advent of the internet,
Mm-hmm.
people, all kind of conspiracy was there. And then look at where we are now. We are really into the heart of smart,
Mm-hmm.
where we have AI and all of that and so forth. So it shows too that even in our lifestyles, there are things that are changing very
Of
quickly
course,
too.
of course.
And hence the reason why we want to discuss these particular areas. So we really want you to come on down. Space is limited. I don't know if you've been to the auditorium of the University of the West Indies. Space is limited, so the early bird catches the worm. We want you to come on down and be there. We want to start at 6:30 and end about 9 o'clock.
Okay.
Yep. So that's what we're going to do. All right. So what we're going to do, we are going to take a break, and
Yes.
then we will be right back with our guest this morning.
Mm-hmm.
She will be joining us virtually. So we are just going to take a break to connect. Oh, and if they say convenience could make a big difference, then you can trust me. I know just where you should be. That is JP Mega, 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 Mega. The one stop shopping, Dominica, nigga, 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 nigga. You could be shopping and having fun with your daughter or with your son. We get out to everyone. What a happy place, happy place. Oh, JP Mega, 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 Mega. The one stop shopping, Dominica, nigga, 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 nigga. You could be shopping and having fun. Bring Papa and Mama along. We get that to everyone. What a happy place, happy place. Oh, what a happy place. Purchase 6 or more of any item and you automatically qualify for a discount. Check us out at the Mega Store in Funkole, where there's lots of parking on Monday to Friday from 9 a.m. to 7 p.m. On Saturdays from 8 a.m. to 6 p.m. and on Sundays from 10 a.m. to 2 p.m. JP Mega, the best family shopping experience. Oh. So we're back with you this morning on Health Vibes. As we say, this morning we are in for a very interesting topic. Many of us know that we are in the common cold period, so season. Many people are coming down with the common cold, and have actually gotten the some people have actually gotten the flu, which has even caused hospitalization, particularly in the elderly and young children. And so this morning, we are going to explore this particular common cool season that we're in. And we're also going to be talking about the big boss that is in the international news relating to the HMPV, which is one of the new, well, it's been a wrong, but one of the viruses that is trending from China that many um, world leaders are looking very closely at. We're also looking at bodies that relates to health and wellness. So the World Health Organization, CAFRA, PAHO, all these organizations are looking at the what's happening with this virus and how it may impact countries. So this morning we have with us an infectious diseases specialist, um, Dr. Cleola Peters. She's joining us virtually, and, and she's going to actually discuss the common cold the flu and that particular virus in question that so many of us are concerned about, particularly as we are now in the carnival season. We know that many people will be arriving in Dominica for carnival, and some of us are a little apprehensive, wondering, should I participate? Am I at risk? And questions such like this. Dr. Peters, good morning to you.
Hi, good morning, Carlton,
Yes,
and
good
good
morning,
morning
Dr.
to the listening
Peters.
public. How are
We're
you?
hearing you a little low. Let's see if we're hearing you better. Are we hearing you now?
Good morning. I'm
All
hearing you
right.
clearly,
Okay.
Carlton. Are
All
you
right.
hearing me?
Yes, I am hearing you very clearly.
Okay.
Both I and
So
my co-host.
good morning to the listening public also.
Yes. Good.
Thank you. Good
Good.
morning, Dr. Peters. Good morning to you. Dr. Peters, as I did mention, as an infectious diseases specialist here in Dominica, we know generally around the month of September all the way to February or even early March is the common cold season. We've heard many talks in the past about the common cold, even more so during the period of COVID-19, where all the protocol and guidelines were established and we had to adhere to. Yet still, it seems that every year we still kind of ignorant as to what we should be doing and almost not cognizant that we are in that season. Just give us a short synopsis as to um, that particular season, the cough and cold season, what we should be doing, what we should know, and what we should be doing to protect ourselves.
Okay, Kelsey, you're right. You don't mind if I call you Kelsey, right?
No, no problem at all.
I'm surrounded by Kelsey. Okay, so you're right in saying that the cold season usually comes about September into March. So basically, on the onset of autumn into
Hmm.
winter and early spring. So where there's a drop in temperature, and we know that viruses, a lot of the respiratory viruses, they proliferate um, very much so during the cold season. We also know that during the cold season, also persons are, usually indoors and with windows and doors closed. So ventilation is a little bit poor, and we're talking about in the colder countries.
Hmm.
In our case, what happens during the autumn, winter, spring season, we have increased visitors. We have our festival, the Creole Festival. We have Carnival, and there's also, the cruise ship visitors or visitors that are running away from the cold.
Hmm.
No, whenever persons enter your country, they may enter with whatever they have acquired from the country they have left or via the vessel in which they come to the island.
Yes.
So it is a thing from way back. We know that it's the flu season, the cold season, and all of us have gone through it. I don't think there's any child who has not gotten a cold.
Hmm.
And that is all in the process of also building up our immune system. Now, one may say, but why am I getting a cold more than once?
That's the
In
question
the
people
same
always ask.
season.
Hmm.
But we have to realize there are many microorganisms, including viruses and bacteria, that can cause upper respiratory tract infection, okay, through like symptoms. So one can get infected by various agents, various microorganisms in the same period of time, meaning during the same winter season or in the same month, or they can even get repeated infections by the same microorganism. So we always have to be prepared, for the flu season. And preparation is simple, Kelsey. It
Hmm.
doesn't change. For the time, it hasn't changed. And one of the things that COVID-19 did, it increased our sensitization and awareness of respiratory infections and how we prevent such infections. And it's the same,
Hmm.
healthy mind, healthy body.
Hmm.
and also respiratory etiquette, proper respiratory etiquette.
So, doctor, let me just interject a little. So, let's suppose that currently people are listening to our show. There may be somebody in the workplace and they're coughing. They exhibit at least five symptoms that would
Mhm.
warrant, some type of maybe taking some time off from work or visiting a doctor like yourself. But they are reluctant. I will be better. It's just, something. What advice would you give to somebody like that in the workplace right now? And how risky is that particular decision to the rest of the workforce?
Okay, so cousin, um, we have to talk about how respiratory infections like the flu, common cold are spread.
Hmm.
And basically, they are spread through direct contact with secretions from somebody who's ill. So the virus or the bacteria is transmitted from respiratory droplets, from our mouth secretions from our mouth and from our nose. So when we cough, when we sneeze, we propel these germs, we spread the
Hmm.
germs into the air. If our secretion falls on our hands, or we use our hand to cover our mouth, and then we shake somebody else's hands, or we touch something else, we're going to transmit the virus or the bacteria through our hands. So we have respiratory droplets, that is through cough, sneeze, through the air. We have direct contact, like touching a person
Hmm.
who may be contaminated with the secretion, or touching a surface, example, a door, a table, and especially with children, toys.
Yes.
Sharing toys and touching toys, direct contact like kissing a person with the flu. These are all ways that the virus, respiratory viruses, can be transmitted. So one of the ways to prevent transmission would be one, isolation. And isolation does not always mean you stay home. Okay, isolation means that if you have mild symptoms, you're coughing, you're sneezing, you could use your mask. Use
Okay.
the mask in public to prevent the infection from spreading. When you cough, you sneeze, use a napkin. Cover the nose, cover the mouth, and discard the napkin in a bin, or you could have a little plastic with you where you discard the dirty napkin. Try to avoid using the same napkin over and over, because each time you take it out, you're just going to spread the germ back into the air.
Mm.
Another method of prevention is sanitizing, and we heard about that a lot during COVID, and it still pertains to every flu season. Sanitization after coughing, sneezing, you wash your hands with soap and water, or you sanitize, you can say, or and you sanitize with an alcohol rub. So an hand sanitizer, with 70% alcohol or more, we sanitize our hand, rub our hands back, front, the fingertips for about 20 seconds.
Mm-hmm.
Okay? So these are ways to prevent the virus from spreading. Another thing also, we need to be healthy. So as you rightly said, exercising, your cardio jam, eating well, eating healthy, taking a lot of your fruits, your citruses. These are going to help to boost your immune system. The vitamin C, your zinc, your D, the sunlight, they're very important. One thing about the viruses, and Katya must mention here that there are some viruses that are the most common causes of the flu, or the cold or respiratory infection during the winter. And there are things like the seasonal influenzas, the respiratory syncytial virus, the human metapneumovirus, and also we have the rhinovirus. There's also the bacteria like Mycoplasma pneumoniae. These are all frequent causes of respiratory tract infection, and they have been around for some time. None of them are new. The coronavirus is also another virus that causes the flu. It has been causing respiratory infections from time back. However, a few years back, we had a mutation in the virus, and then we had COVID-19. which was a new variant of the coronavirus, and
Mm.
hence know the results of COVID-19. Likewise, the viruses I call, or the usual seasonal viruses and bacteria that cause the flu, they can cause mild symptoms, the cough, the stuffy nose, the leaky nose, which we call rhinorrhea,
Mm.
the chest congestion, sneezing, sometimes a little body pain and fever. They can cause that. Usually they're self-limiting, and you get sick for a couple of days. You drink one, two little bush tea, your juice, your oranges, etc., and paracetamol, and usually recuperate. But there are cases where the infection may evolve, it may get worse, it may cause the person to deteriorate, the person may get a pneumonia,
Mhm.
and especially in the younger, children, those less than 5, and the elderly, who are persons older than 65, and also persons who are immunocompromised, meaning their immune system are weak.
Mhm.
They are at greater risk for getting complications of these common viruses and bacteria. So
Mhm.
these are persons that may come down with pneumonias, they may get respiratory distress syndrome, they may get complications like encephalitis, like infection of the brain, they may get, it may even result in death at times.
Mhm.
Mhm.
But usually these are in cases, as I said, the vulnerable population, like the young and the elderly and those that are already immunocompromised.
Mhm.
Mhm. Doctor, I have two questions, but I will start with one. You mentioned several common viral agents that cause flu-like symptoms. Does it matter that you know what is the viral agent that's causing your symptoms, or is it just we focus on the symptoms and not the causative agent? I wanted to know about that. Does it matter if it's a COVID-19, or if it's an influenza, if it's a or are we just focused on symptomatic, or should we just be focused on the symptomatic relief?
No, it's always good to know what is circulating in your
Mm-hmm.
in your country
Mhm.
Mm-hmm.
or on your island. So every person who comes down with the flu will not be tested. But it is good to carry out some tests, especially in persons who are admitted,
Mm.
persons that have complicated manifestations of the disease, to know exactly what is circulating. Now, because the cold, the common cold, the causative agents, are known, and the common cold is is yearly. It's a seasonal event. There may be places, some countries that don't always test persons who come down with mild symptoms,
Mhm.
but persons who have complications, or persons who are admitted, especially, it's good to test
To
to
know.
determine what is going on. At the earliest stage of any outbreak, when you see figures are rising in any disease condition, for example, there's an increase in persons with, diarrhea, a person not seeing diarrhea, but you're getting 1 to 3 cases of diarrhea. It's the cases of persons with the flu, and there's no flu. It's always good to take samples, because you need to know what is circulating. Because what may be circulating in your country may not be what is circulating somewhere else, or what is causing um, a lot of morbidity or illnesses in your country may not be the prime cause of illnesses in other countries. So
Right.
it's always good to know, and that's why when persons seek medical attention, the health personnel will um, ask them that, can I take a swab? Can I
Mm-hmm.
take a sample? You should have a test done to see what is growing in your sputum.
Mm-hmm.
We need to do a swab for you of your nasopharyngeal area to region to see what virus may be in there, what is causing you to have these respiratory symptoms, what is causing you to have the flu. But from study, and we know that internationally, I mean WHO, as you say, PAHO, CAFA, as Carlson mentioned, they have different monitoring systems. So there's the respiratory monitoring system where all influenza-like viruses and so that are captured in a country or test done is fed into this system. So worldwide, it's being monitored to see where are we having outbreaks and what are the causative agents of
Mhm.
these outbreaks
Mhm.
and what actions need to be taken.
Mhm. Yes.
Doctor, whilst you on, we've been hearing a lot about, especially in the international media, relating to the virus, and I'll put it like that. That's in China, and we've begun seeing the Chinese wearing the mask, and we've seen footages where there are many people at healthcare facilities seeking evaluations and assessments, and the governments throughout the world are somewhat concerned, and they're they're paying close attention to what's happening out there. Should we be concerned? And can you just sensitize us on that particular virus, the HMP virus, human
Pneumovirus.
yeah, virus? Yes, this particular one.
Okay. All right. So the human metapneumovirus is not a new virus. It is a virus that causes respiratory tract infection. It can cause mild symptoms, and it can cause complicated um, symptoms. It can become complicated into a pneumonia and possibly even fatal, like any other respiratory tract infection. Um, it's not China alone that has the virus. That virus is found, all over the world. It is found in the northern hemisphere also. It is found in the Caribbean. As I said, it is a virus that causes the flu,
Hmm.
like influenza, like rhinovirus, like the respiratory syncytial virus. So it's not a virus that we have to be alarmingly concerned about. It deserves no greater concern than the concern we have for any other virus that causes or bacteria that causes the flu. It's just that what happens in different regions, you may have one particular etiology predominating. So one particular gene may predominate in terms of the cause of respiratory tract illness in any area. We saw that when COVID came about, most of the other agents, like influenza, the RSV virus, which is the respiratory syncytial virus, the human metapneumovirus, they cause less of the respiratory tract infections that we saw because COVID-19 was new and it was very virulent. So it predominated. So in China right now, according to the news, we're seeing an increase in the human metapneumovirus. It could have easily been an increase in the respiratory syncytial virus. So it's not something to be alarmingly concerned about. But we have to know that we're in the flu season. We know that respiratory infections are easily transmitted. You can easily have outbreaks, especially when you have mass gatherings.
Hmm.
And we have mass gatherings coming up. It's at schools where you have persons, in a closed area, constrained area, schools, the creche, the daycares, the elderly home. So
Yes.
it's very easy for any respiratory germ, respiratory infection to spread in these populations. So that is what we have to bear in mind, and we have to be always a little proactive in terms of our prevention of these conditions, prevention of the spread of the respiratory infection.
Mhm.
And hence, it goes back to the same basic thing: the respiratory etiquette, the mouth covering, the mask wearing, the hand sanitizing, the hand washing, the disinfecting of surfaces, disinfecting frequently of surfaces that are frequently touched, like doorknobs, counter, you know, and that's it. In the event that there are increased cases, of course, I mean, we have public health system, and we will be informed, we will be given directives by our public health system in terms of what extra needs to be done. Or they may just encourage the population to be very proactive in terms of decreasing the transmission of respiratory um, infections.
Mm-hmm.
You
Alton, my second.
understand? Mm-hmm.
Yeah,
Yes,
doc.
my second question, doctor. I didn't want to forget this one. We speak in prevention, but I wanted to zone in a bit on infectious period. I know a lot of people, myself included, have had a
Mm-hmm.
respiratory illness. I don't know if it was what what is the causative agent, but have had flu symptoms,
Mm-hmm.
and these symptoms, particularly the coughing, are prolonged. So people have been experiencing prolonged coughing spells, for instance. How do you know, or how do you gauge? Okay, this person is infectious still, or this person is no longer infectious but just I'm coughing. Some people will tell you, I don't have the flu, I'm just coughing, it's just a cough. What
Mm-hmm.
should be um our mark in that regard? So, and I'm really talking from personal experience. I've been coughing for a month. What should be my marker in terms of how do I prevent other people from possibly being infected? Am I infectious? Am I not? That's a question that I wanted to pose to you.
That's the question I
Okay.
was going to ask too.
So viruses usually are very short-lived.
Hmm?
So usually in a period of less than a week, usually um, by 5 day 5, one is usually non-infectious. That is
Mm-hmm.
when the virus usually runs its course. You have fever because there's a period called the incubation period when one may be in contact with somebody with the virus, get the virus or get the infection and not exhibit any symptoms. And that's the period in which the virus is in your body multiplies. So the incubation period may vary. It's usually about 3 to 6 weeks, 6 days, sorry, 3 to 6 days for many of these infections. They can extend up to 14 days, as we've seen in cases like COVID virus. But in terms of being infectious, a virus usually runs its course in about less than a week, so about 5 days. There may be cases it may be a little bit more prolonged, to 10 days, or in cases where one becomes complicating in terms of pneumonia, getting a pneumonia as a result of the respiratory tract infection, then they may be contagious for a little bit more. At that point, you may have secondary infection, meaning you may have bacteria now complicating the whole picture. And hence in coughing, while we're coughing, while we still have secretions and the infection in the lung, we're still infection. And in
Mm-hmm.
these cases, we would need to give the patient antibiotics,
Mm-hmm.
Mm.
okay, for
Okay.
the infection. Usually after the course of antibiotics, which is usually a week or 7 days, the patient will have recuperated, so they'll no longer be infectious. What you may have is a lasting a cough that may go on sometimes a month, sometimes more than a month, because there is a little bit of inflammation. So
Mm.
then we get inflammation, we get fibrosis, so you're left with a bronchitis. Not an infectious one or pneumonitis, but one as a result of the infection usually you recently had.
Mm-hmm.
So that may be the reason why you're coughing. But in terms of the viruses are usually short within a week.
Yes.
Oh, that's well. That's very good.
Mm-hmm.
And in because this is something that we hear all the time in the pharmacy too, where people would come and say that they have used several cough and cold medicines and they're not getting any redress. They're still coughing a
Mm-hmm.
lot, and we oftentimes have to say, well, maybe you need to do a chest X-ray. You may need to get
Mm-hmm.
assessed again to see what's happening to find out the underlying, because we really don't encourage just giving them something again. We prefer
Right,
that they get the
right.
assessment done. Sometimes it's just an allergen too that might be
Mm-hmm.
the
Mm-hmm.
causative agent. So
That is true.
I'm glad that you highlighted that, because it's one of the key symptoms that many people are coming down with at the moment.
Cough.
Doctor,
Mm-hmm.
as you
The
on
cough.
to, I want to talk a little about the use of antibiotics,
Mm-hmm.
because it is one that is always a major
Mm-hmm.
contentious topic, because
Mm-hmm.
even
Right,
as
right.
pharmacists, we sometimes get people get very angry for us when, they walk into the pharmacy and they're like, oh, I know what's happening to me. I know if I go to the doctor, is antibiotics they're going to give me. Why you want me to go and spend that amount of money and not give it to me? And that type of thing. They just think, well, once they get the antibiotic,
Mm-hmm.
all the other symptoms that they're experiencing will dissipate, it will go away, and they'll be fine. In what and when are antibiotics warranted in the use of alleviating or managing cough and flu symptoms?
Okay, Kathy. So, as I said, most of the cough and cold symptoms, most of the seasonal respiratory tract infections are caused by viruses. So, they're very much characterized by, cough, fever, nasal congestion, and they basically require symptomatic treatment. Okay, treatment in terms of your analgesics, your hydration, rest, a little steam inhalation. Now, in cases where the symptoms seems to progress um, in terms of respiratory distress, um, increase coughing, productive cough, meaning that the patients start producing sputum or what we call coal
Hmm.
from the chest. That is thick, it's yellow, it's green with shortness of breath. Then it means that person needs to get assessed by a doctor. They should definitely go to a doctor because, as you rightly said, there may be something more.
Hmm.
Based on the doctor examination, the doctor will decide whether the patient should be placed on antibiotic or not. Because if you place a patient with a viral infection and antibiotic, it's not going to make any sense.
Hmm.
It's not going to work. All we're doing is just exposing that person to possible resistance
True.
of to that antibiotic. Because if we do use antibiotics irrationally, what we're going to have in the long run is a whole set of germs that are going to be resistant to the antibiotics.
Hmm.
And then when we need antibiotics, the antibiotics will not work.
Yes.
So it is not recommended that antibiotics are given for the flu or respiratory tract infection unless it is complicated and there are signs that there is an infection.
Hmm.
And on examination, if the doctor examines the patient, you will see and hear, you know, the signs
Yes.
of an infection. The doctor will examine, will ask you to open your mouth, you'll check the tongue, the doctor will check the lungs, the doctor may hear secretions. There are certain songs that the doctor will hear.
Hmm.
Your oxygen stat will be checked, blood tests will be done, x-rays will be done. So there are complementary tests that will help the physician with his final decision to give antibiotics. I know it's becoming a thing in our culture now where person thinks, okay, once I have fever and I have, signs of an infection, I should get antibiotics. But no, many things cause infection
Hmm.
or
Mm-hmm.
many things cause fever. There are even things like, as you rightly said, allergies can
Yeah.
cause fever, you know, um, stress can cause fever. There are different things. Fever is a response of the body to any aggressor. So
Hmm.
it's not always infection that may cause fever. You may have metabolic a metabolic condition that causes you to have a fever, or it, one could have a malignancy or cancer that is, causing them to have a fever. So it's not every time there's a fever or there's a cough or a cold that we have to treat with antibiotics. No. If we have the flu, usually, as I said, by day 5, you recuperate. If by day 3 you find you're not getting better, you're getting worse, then seek the advice or the attention of a medical doctor. And that's my advice, Kelsey.
Mm-hmm.
Very good.
Yes.
Well said, doctor.
Yes. Yes. Yes.
Well said. Well said. And I do hope that our listeners would have gotten the facts, because many times people, hear, or they listen, they hear, not listen.
Mm-hmm.
But we do hope that today they listened to what you've had to say. I think you were
Right.
quite comprehensive in
Oh,
terms of
yes. Yes.
the different viruses that are that are wrong, that are affecting us, what we should be doing, and all of us should be adhering to the similar protocol and guidelines that were given during the COVID-19 pandemic.
That is right.
And as you said to us too, we should not be panicking
No,
regarding
there's no
this.
reason to.
That's it. Regarding, because I've
Mm-hmm.
heard people say, "Oh, maybe they're going to shut down again," and all kind of things. And
Mm-hmm.
no, there isn't anything to panic about. We just want you to just. I've begun seeing people using their masks. Some
Wear
people,
masks.
especially some of the older people,
Mm-hmm.
when they go out.
In crowded
Hmm.
locations, I noticed, and some people, from the COVID-19 pandemic, have maintained
Yes.
that behavior. I see older people, for instance, at church,
Hmm.
continuing to use their mask, and it's good practice. As
It
doctor
is.
said, if you
It is.
particularly at risk, you should take the necessary precautions.
Hmm.
It
Hmm.
is. And let me just add, um, in terms of children who are sick, infection spreads very easily, especially respiratory infection spreads very easily among the children. So it's advisable if your child has signs, of a respiratory tract infection, fever, cough, cold, the child should be kept away from school.
Hmm.
Don't send the child to the daycare. By the time you send the child to the daycare and decide the next day you'll keep home the child, you may get a whole set of other children infected.
Hmm.
So, because we know children are all in each other's faces, they play with each
Yes.
other's toys, they
Hmm.
touching surfaces and their hand goes in their mouth. So, we have to be conscientious as parents, and we have that responsibility to our society, to our community, by preventing the spread of these infections. So it's advised that the parents keep the children home.
Hmm.
Doctor, is it possible that you could take a few calls from people?
Okay.
Uh,
But Kelsey, I do have a limited time,
okay, all right. Well,
so
at
I
least
can
maybe
give for
just
two
one.
minutes.
Okay, all right. Let's take this call. Hear what this person have to ask. Good morning to you, caller.
Good morning, Carlton.
Good morning to
Good
you.
morning to the doctor, and good morning to your host in studio.
Good
I
morning.
have two I have two questions. The difference between a virus, a bacteria, and a germ. And the second question is, how is that every time there is some major outbreak of something, it starts in China? Thank you very much.
Thank you. Dr. Peters. Dr. Peters.
I lost.
Okay, we seem to have lost her,
Mm-hmm.
unfortunately.
Mm-hmm.
Um, uh, Again, we had a virtual, and I suspect maybe as she
Maybe
said, she
got
had,
knocked off by the
yes.
call. But Carlton, I mean, we could answer that question
Yeah,
though. We
I
could
think so
answer that
too.
question. The first question was virus, bacteria, and germ.
Germs. Hmm.
Germ now is just a overall generic term used to describe any microorganism, something you cannot see with your eye. People just call it a germ, something that will cause sickness. A virus is something you cannot see with your eye that can cause disease, and the bacteria is a living thing. It's classified under living things. You also cannot see it with your naked eye. Some bacteria cause disease, some don't. So there are bacteria that live within us, cause no disease. There are some bacteria that can cause infections. There's some bacteria that we use, for instance, in the food industry,
True.
bacteria that is used, for instance, your yogurt, your cheese, and so on. So all three terms, sometimes people use them interchangeably, but one is a generic one, and the other two are, specific ones. The doctor
Yes.
is back.
Yes. I wanted to ask, there's somebody that actually sent a message as well, and they were asking about the link with respiratory infections and the air. If you want to comment on that, particularly ear infections around that time as well.
Okay. What Currently what happens? Hello.
Yes, we're hearing you,
Yes, we're
doctor.
here.
Okay. So what happens in terms of upper respiratory tract infections? There's usually congestion in the upper airway. And if there's congestion, it inhibits the natural flow of secretions from the ear to the back of the throat and, first to get rid of whatever is circulating in there. So once this happens, you have a backup of secretion, there's congestion. We know there are bacteria that normally, live in our upper airway. They live in harmony with our upper airway. But if there's any shift in the balance, they can cause infection. So
Mm.
these bacteria here, because of the change in the environment, in the middle air to the oropharynx, then you'll have an overgrowth of these bacteria. You'll have colonization of the bacteria in these areas, and that leads to what we call the ear infection. So there'll be pressure in the inner ear, so pressure in the eardrum. There may be a little bit bulging of the eardrum. And one may note that as soon as one starts using anti, um,
Inflammatory.
no, not only the anti-inflammatory, but decongestants
Mm-hmm.
and the steam inhalation. Steam inhalation, not steam with eucalyptus or with Vicks or any of it, just plain steam. It helps to moisten the airway and open up the airway, so it decreases the congestion, so the secretions flow. And then the effect of the antibiotic helps it to helps the person to heal. It helps contain the infection and kill the bacteria.
Mm-hmm. I know, doctor, you have to leave soon, but I wanted to ask you another question quickly in reference to tonsillitis and children. We've seen
Mm-hmm.
cases where children get repeated relapses of tonsillitis 3, 4 times a year, and
Mm-hmm.
that is a problem. Should we? I mean, some doctors believe that the children often will grow out of it and should not remove the tonsils and what are your views on that one?
Well, in terms of the tonsils have a purpose. They're one of the first line of defense in
Mhm.
terms of respiratory infections. They're one of our first guard against germs and so that maybe enter in the upper airway. And hence, we do expect children, especially, to get recurrent tonsillitis just because of that. Their immune system is developing. Um, Not all tonsillitis needs antibiotics. Sometimes, as you rightly said, anti-inflammatory can do, and the goggles. But in cases where there's bacterial infection of the tonsils, then antibiotics is warranted. Now, if this child keeps getting repeated infections, I mean, it can affect the quality of life of the child.
Hmm.
So one of the things that the doctor and the parents have to do is, have a discussion and decide whether in the best interest of the child for now that the tonsils be removed.
I get you. So it's all about the
Hmm.
quality of life, how it's impacting the child's quality of.
Yes,
I
and
get.
how often does the child get the attacks, the discomfort, the pain, admissions, etc., that the child goes through, and how big are the tonsils? Because some cases the tonsils may be so big that they may obstruct the upper airway.
Mm-hmm.
In cases like that, you have to intervene.
Yes. Yes.
Intervention is warranted, or else the child will die.
Mm-hmm.
So many things have to be considered. In medicine, it's not just what you see. You have to always go a little bit further than just what the eye sees.
Mm-hmm. I have one more question for you before you leave, and it's in reference to we've seen even if pets, cats and dogs having the common cold, and they sneeze in, and they may not cough like we do, but they're doing their thing. Um, are their droplets as contagious as ours, and can someone get the cold from a cat, or if they have a cat and the cat is sneezing and so forth? What are your views
Mm.
on this one?
Well, yes, it is possible. There's some viruses that the animals get that can be transmitted to us, and that's the things like you heard about avian flu and swine flu. So these animals, our pets, can get sick. Not all of the viruses will affect us. Our immune system can deal with some of the viruses, but there's some viruses that can be transmitted
Mhm.
to human to human owners or persons in close contact with animals.
Mm-hmm.
Mhm. And Carlton, before I leave,
Yes, doctor.
there's something I want to mention. Most persons do not take advantage of the vaccines for the flu, but note that there are vaccines that help prevent the flu or respiratory tract infections by certain organisms. Of course, one vaccine cannot cover all the microorganisms because we know there are millions of microorganisms or germs that can cause respiratory tract infection. But at least there's some vaccines to cover the most common ones. Unfortunately, we don't have a vaccine for the human metapneumovirus.
Okay.
But there are vaccines here for, respiratory syncytial virus, for certain influenza viruses.
Are
So
these
persons
are
can
these
take advantage of this.
are these vaccines available in the primary healthcare system? Are they available or private doctors?
Yes, there are some private doctors that do carry the vaccines for the flu. In terms of the public health system, I'm not able to speak too much about that.
Okay.
I do know that there are campaigns. They usually have campaigns for vaccination against the flu. So that means at some point they do carry it.
Okay.
But I know there's few providers that, for example, myself at Total Care Center, we carry vaccines like the respiratory syncytial virus vaccine, the pneumococcal. I know Dr. Burnett, Dr. Joseph, also Dr. McIntyre, Rhonda McIntyre. They're also practitioners that um, supply or provide vaccination for these viruses and bacteria.
Dr. Joseph, I said Dr.
Dr.
Joseph,
Peters.
Dr. Peters. Just before you leave, can you, if you want to share your office number with the listeners, just in case someone may want to make an appointment to see you
And
regarding
location.
right and location and as an infectious disease specialist, everything to do with infection. So whether it's a urinary tract infection, you may suspect you something on your genitalia, you don't know what it is, you may suspect something on your skin, whatever it is. This is the specialist that deals with it. So if you want to leave your office number with us, that'll be good. That people can contact you.
Okay, so our office provides services in terms of
Yeah, you know.
general health and also infectious diseases and travel medicine. Um, Persons sometimes need advice, when they're traveling as to what
Mm-hmm.
vaccines they should take and where can they get it. We do supply vaccines. We do administer vaccines. We can also give advice in terms of what medications one may need to travel with,
Mm-hmm.
what precautions based on where one is going. Our office is part of the care complex. So there's digestive care, there's honest care, and there's total care. And we're located at 7 Shillingford Crescent. That is opposite Marboyd's bar, that area close to the port in Bridge Bay.
Mm.
It's 2 buildings before the Fonkole Health Center.
Ah.
And yes, so we have a gastroenterologist, so colonoscopies, gastroscopy, etc., can be done at our office.
Mm.
And we also have an anesthetist. So if persons need a private assessment or assessment prior to doing, having a procedure done, or person needs management for chronic back pain or nose pain, if person needs um, just a general health check or any medical issue, we are there to provide you our service. So
Awesome.
my number is 295-8515. We also do home visits and virtual visits.
Mm.
Nice.
So that's 295-8515.
8515. Thank
Dr.
you.
Peters, thank you so much for joining us today. We
Thank you for your
truly appreciate,
time.
yes, we truly appreciate the information that you disseminated to our listeners this morning. Thank you so much and hoping to connect with you in a subsequent time.
Okay.
Have an
Thanks for
awesome day.
having me on.
Thank you, Dr.
Thank
Have a
Peters.
you.
blessed day all.
Bye
And
bye.
thanks to the listeners.
Thank you, Doctor. Bye bye.
Okay, bye-bye.
Yes,
Trudy,
Carlton.
at this time, what we should do? Take a
Take a
break?
break.
Yes, let's take a break. Yes.
Who say health cannot have vibes? Well, Jolly's Pharmacy is proving you otherwise. With Health Vibes, every Wednesday morning on Q95 from 10 a.m. to 11:30. Health Vibes, education, information, and a bit of humor. And not forgetting lots of vibes. Hosted by Carlton Langdo, with co-hosts Jacinta Fagan Defoe and Trudy Kristen. Jolly's Pharmacy is bringing health and vibes together every Wednesday, so be sure to tune in. Health Vibes every Wednesday on Q95 from 10 a.m. to 11:30. Jolly's Pharmacy, leading the way in healthcare. Oh, and if the convenience could make a big difference, then you can trust me. I know just where you should be. That is JP Mega, 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 Mega. Your one-stop shopping, Dominica, nigga. You could be shopping and having fun. With your daughter, with your son. We cater to everyone. What a happy place, happy place. Oh, JP Mega, 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 Mega. Your one-stop shopping, Dominica, nigga. You could be shopping and having fun. Bring Papa and Mama along. We cater to everyone. What a happy place, happy place. What a happy place. Purchase 6 or more of any item and you automatically qualify for a discount. Check us out at the Mega Store in Funkole, where there's lots of parking on Monday to Friday from 9 a.m. to 7 p.m. On Saturdays from 8 a.m. to 6 p.m. and on Sundays from 10 a.m. to 2 p.m. JP Mega, the best family shopping experience. Who say health cannot have vibes? Well, Jolly's Pharmacy is proving you otherwise. With Health Vibes, every Wednesday morning on Q95 from 10 a.m. to 11:30. Health Vibes, education, information, and a bit of humor. And not forgetting lots of vibes. Hosted by Carlton Langdo, with co-hosts Jacinta Fagan Defoe and Trudy Kristen. Jolly's Pharmacy is bringing health and vibes together every Wednesday, so be sure to tune in. Health Vibes every Wednesday on Q95 from 10 a.m. to 11:30. Jolly's Pharmacy, leading the way in healthcare.
So we're back with you. It's now 11:22, and we just have about 8 more minutes with you this morning on Health Vibes. I do hope that the information that you have received regarding the common cold and flu was well received, and some of the questions or issues that you may have had floating in your mind were dealt with and you got the answers. But I see we have a caller. Let's
Yes.
take this caller at this time. Good morning to you. Good morning.
Hello, morning, Trudy.
Good morning.
Carlty. Can I call
Morning.
you Carlty?
Yes,
Morning, Carlton. How are you?
I am doing quite well.
Uh,
Good morning.
I listened well, but something, I still have something came into my mind because all what she said, she giving vaccine, she doing that, I myself never knew about that. I'm just,
Yes.
because I don't know the doctor, but, I am not aware of that. I was wondering, could, Jolie's, that is me, you're the one to take it, I'm just suggesting. Could you all invest in a medical directory? Say, for example, you list all the doctors, and you say there's something for that, at a fee, and then we pay, like we buy the directory. Just a suggestion.
I do that all the time for sure. I mean, when people come to see me based on what their situation is, I will know directly who is the best to send them to.
Yeah,
So
but I was
it's
thinking
something,
like
but
if you have
Something you
something
could
yeah,
for
but
buy.
it,
it's something we can organize that.
Okay.
Something we
I
can.
I do know that there's something online that was started. I believe it's by a young bull Val Coffee. It was an online medical thing. I don't know how well it took off, a website that was showcasing like the different doctors' offices. I think maybe the doctors would have had to register to be on the site. But I think that's a a good endeavor. It's a repository you can use for when you don't know who to contact. I also feel the same way about our skills people. Yeah,
Yeah.
like I've always said, we need to have a directory. Right? People, when you need a plumber, when you need a this, you don't know who, where, how, But these things are for modern society. We could definitely invest in that. Somebody could take up that challenge. And as she said, you could pay to access it, whether it's a printed thing or it's an online thing, but you pay something to access it if they cannot meet you, Carlton. Another thing people do is, yes, they will ask people like you for things to do with, for instance, women's health. People will ask me, but sometimes you cannot meet the person at the time you want to go to a practitioner. You just don't know who. So something like that would be helpful for sure.
And we get the same thing with mental health. You
Uh-huh.
see a
A
counselor.
lot of people ask me, yes, a lot of people will, you're right, will send me a WhatsApp and say, I heard you, who is the counselor, or who is this, the psychologist you said you went to, and what's their contact? And, no, I have certain contacts in my phone, and I will share. I have more than one. I have about 3 people that I share with people when they ask. But that's another area people always don't know who they can go to.
That is
Mm-hmm.
good.
Mm-hmm.
All right, so it's now 11:26, and as Dr. Peters again said in wrapping, um, we just need to be more conscientious. We need to follow again the typical protocol that has been established: hand washing, hand washing, hand washing. The etiquette of sneezing in your elbows. If you use a napkin, preferably a napkin, you don't want to have a towel. You want to use preferably disposable napkins that you can dispose on properly after using. If you have the common cold and flu symptoms, it might be best to take a few days from work and get yourself, better rather than.
Particularly as the doctor said, in that infectious period, which
Mhm,
might be, that first week. So
mhm.
that is a good time to make sure you stay away, from
Yes.
from your colleagues or your
And
friends.
she did
Hmm.
mention about the children,
Hmm.
who
Stay away from
access,
school.
yes,
Hmm.
school and
Or daycare.
daycares. And
Hmm.
yeah, I know parents often say, but who is going to look after my
Right.
child after work? But you
Yeah.
don't
So
want to be selfish.
right. So then you sometimes you have that problem of child care, like who will take care of the child, but then in in trying to solve that problem for yourself, you end up creating a major
That's
problem
it.
for 10,000 other people,
Mhm.
So the child, if you had to miss a day to keep the child home, that would have been a problem for you. But sending the child to school or to daycare, and 30 other people get
Yeah.
infected, that's a big problem.
Mhm. And know again, there are many cough and cold medicines that are available at Jolly's Pharmacy. We always recommend that you have a dialogue, you have an interaction with our pharmacist or pharmacy technician before selecting a cough and cold medicine based on the symptoms that you may have, based on underlying medical conditions that you may have, based on existing medications that you may be using. They can actually cause drug interactions with some of these cough and cold medicines. So we want you, yes, to get something, but we want to make sure that we make the right selection to you, particularly if you have underlying medical conditions, as I said, and if you are currently using medications. We want to know what medicines that you're using to ensure that you are
Mhm.
given the correct cough and cold or allergy medicine at this time.
Elton, I just want to back you up on that. It is the season where advice on treatment is rampant. We have the colloquial thing we say in these days, rampant.
Yes.
But yes, everybody wants to tell you what to
Hmm.
use for your cough or
Yeah.
cold.
Hmm.
So everybody will say, no, take that. Um,
That probably work for
that
me.
had worked for me. So people have told me, Carlton, I bought that by Jolly's. It was good. You can use that. But the discussion with the pharmacist is the best one to
Yes.
have, because what might have worked for the person would not necessarily suit you. Carlton, as
Mhm.
you said, you may have some underlying condition, you may have hypertension, or you may have diabetes or
Thyroid
whatever it is,
problems.
and that particular cough and cold medication would not be suited to you. So I really want to advocate for that, proper medical advice being sought by the general public,
Mhm.
because I don't understand how we are so comfortable in telling people and being very
Oh,
adamant
yes.
about it. Take that, I am sure.
Mhm.
If you take that, you'll be good. That's how we speak. And sometimes that can be, that can cause a problem for the
It
person.
can cause
Mm-hmm.
major problems. And so we want you, particularly if you're on a blood thinner, yeah?
Mm-hmm.
So we really want you to be, and if you're on a blood thinner and you've gotten the common cold, we really do not want you to go and take no kind of herb and any kind of herb with that particular blood thinner medicine that you're taking. So there are many things that we would want to discuss with you before you make that selection. And even for the people that would have gotten something from overseas in a barrel, they might have sent you some night quail or whatever it is. Yes, we still want to have a discussion with you. Even if you have the item, we want to know what item it is. We want to know what you've taken, and we want to know what medical condition that you're being treated for. And we'll be able to give you the right recommendation. And so, as we leave you, as we've always said to you, year after year, your health is indeed your greatest resource. Preserve it. Have a good morning, everybody, and have an awesome remainder of the week. See you soon on another episode of Health Vibes coming to you, hopefully, next
Next
week,
week.
Wednesday. Bye bye.
Bye bye. Take care.
Oh, and if the same convenience could make a big difference, then you can